All right, fantastic. Well, good morning. Thank you so much for having me. Again, my name is Matthew Trowbridge. I am an associate professor in emergency medicine at University of Virginia School of Medicine, and recently, the chief medical officer of the International Well Building Institute, which runs the Well Building Standard. And it's really been a pleasure to meet all of you guys over the last few days. I've learned a heck of a lot, and I'm really excited to kind of share my perspective on this issue of kind of my opinion on kind of why the built environment matters in healthcare, which I know I don't really need to fully convince anyone in this room of that, but let me give you my kind of take on it. And I actually think it's a great sequencing to come after this amazing discussion about this need to move to kind of consumer, kind of a consumer-focused aspect of healthcare. So basically, over the next few minutes, I'm just going to kind of try to get through kind of three basic concepts. First of all, I am going to share my story on kind of why, as a physician, have I chosen to really focus on my research, my advocacy efforts on the built environment as an aspect of kind of delivering care at a population scale. I'm going to give you my perspective on, well, what could this potentially matter and how could this relate to healthcare? Why does it matter in healthcare? And then, obviously, in a room like this full of very action-oriented people, I'll give you my perspective on what we might be able to do about it, and give you a sense, one tool of many, but one that's emerging, and the group that I've now kind of aligned myself with. How could things like the Well Building Standard perhaps be part of that solution? But let's take that first question. Okay, Matt's story. Why the built environment? I am clinically trained in pediatrics with a second board certification in preventive medicine. I'm an associate professor, as I mentioned, at University of Virginia. Yet, over the last probably 5 to 10 years, my most frequent collaborators have actually been architects, urban planners. More recently, I've been actually working up with institutional investors, commercial real estate developers. And I get asked this question and I actually think it's a fairly reasonable question, like, why is a physician choosing to spend his, her energy in this way? And it's pretty basic. My response is not really meant to be flippant. It is the data brought me here. The reality is that place and health are inextricably linked. There's a preponderance of data now, decades of data, that show that basically if I could just choose one piece of information about you to have the maximum determination power of how long your life expectancy is, turns out zip code is one of the best pieces of information I could choose. It's much more powerful than genetic code. And there's been some really powerful research done on this at the Virginia Commonwealth University that has calculated these maps for many of the cities around the country, showing life expectancy. And if you just look at things like, here's one for New York City, basically just going just a couple of stops along the subway, life expectancy can vary by as much as 10 years. And actually in cities like New Orleans, things like that, it can be 20 years with, like, as a crow flies, living about a mile away from each other. That's intense. And so what's going on here? Well, when you dig into it, we've heard this alluded to over the last few days, it turns out that only about 20% of variation in healthcare outcomes at a population scale comes from the quality of the health care that I deliver in a hospital. 80%, the rest of it, comes from these ideas of the social and environmental determinants of health. So it's everything else other than what happens in a hospital. It's the conditions that you live, it's where you live, it's your access to grocery stores, it's your access to safe and enjoyable places to walk on a daily basis. These are the things that turned out have a huge impact on the behaviors that you have and the opportunities you have to be healthy, and then ultimately what your health outcomes are. And this is not a secret. Pretty much all of public health has reoriented towards this idea of the social and environmental determinants of health, whether it's like large government funding agencies or the Robert Wood Johnson Foundation. The Robert Wood Johnson Foundation actually about 5 years ago reoriented their entire grant making around what they call the culture of health, moving away from just pure outcomes-based grants to explicitly targeting these social and environmental determinants of health. And here's the thing. The key thing that keeps being revealed is out of these social and environmental determinants of health, a lot of them are really hard to change. One of them comes to the top, the built environment. You can shift it. It has a big impact, and we can change it. And that has made the built environment a huge focus, again, not just for one crazy doctor, but really, literally, for all of public health. It's extremely focused on this thing that you do for a living, make places. And it's also not a new idea to think about environment as a source of kind of health promotion and so forth. You know, back as when I trained in pediatrics, the big thing was thinking about lead paint toxicity and so forth. So the exposure of our children to toxic substances. What's changing, and the evidence is showing, is that we're coming to grips at public health as we think less about infectious diseases and acute medical conditions and moving to chronic disease prevention, that we're starting to realize like the way we started making places is having a huge impact on our lifestyles, such as things like making us much more car dependent than we've ever been in human history. So it's just kind of the idea of moving from toxic substance exposure to realizing, oh my gosh, we've actually had some toxic urban planning exposure that we need to deal with. And that's what's going on in public health, and physicians like myself are trying to figure out how to do this. And we're also realizing that, beyond just those kind of slow disasters of kind of car dependency and stuff, we're also realizing that the way we design cities and so forth makes us suddenly vulnerable to things like extreme weather events and so forth. And we all saw that, choose your year, unfortunately. But in 2017, of course, we saw that in places like Houston, where, the infrastructure alone put a lot of people's health at risk. And of course, I think everyone in this room knows that in the era of climate change, these are the types of things, these vulnerabilities are going to become more and more apparent every year. Okay, so that's why, the data. So the good news is that actually doing something about this, thinking about how to design healthy places is actually becoming better and better understood. We really can achieve healthy and equitable communities. And there's a million different examples. I'm just choosing some that are particularly inspiring to me. For example, there's affordable housing development, a major neighborhood redevelopment in Eastlake, Atlanta, which is actually where I grew up, Drew Senior Academy in Eastlake. This project it was amazing. It was just this kind of embedded story of health promotion and focusing on the people there that included very high quality, mixed income housing. It had a charter school and a beautiful YMCA. And the reality is that actually it's been a runaway success. Rates of interpersonal violence have dropped precipitously, and it used to be one of the more dangerous parts of Atlanta, in fact, in the United States. And actually the charter school, the test scores in this school are among the highest in the region at this point. So there's something about an investment like that can really have a massive impact. Similarly, one of the most inspiring projects I'm aware of is another affordable housing project called Mariposa redevelopment, done by the Denver Housing Authority. What was really unique about this was that they used a tool from public health called health impact assessment and thought about the goals in a very structured way, thought about all the different health needs of the people living in the community, and then used it to explicitly set the goals for the development. And what's cool about it is you see it reflected in, so it's mixed use, but what the storefronts are filled with stores that are explicitly laid out and dictated by the results of the health impact assessment. It was really a novel thing, and it's an incredible place to visit if you ever get a chance. The cool part is I've actually personally also had a chance to kind of see when there's that alchemy in life where you get to kind of do things correctly. And I got to participate in a project like this. This was actually a school project that I was invited to join in with a architecture firm in Charlottesville where I live, VMDO Architects. And basically, I just want to make sure I'm about to show you some really cool pictures and stuff, but I want to make sure you understand the place here. This project, it occurred in a very rural, kind of ethnically diverse county in central Virginia, about 2 hours south of Charlottesville. This is not a fancy place at all. So, but the fact that we were able to pull it off here, I want to make sure that it's really inspiring to you. And just this was a school that, as it started, was built in the 50s. There was actually 2 schools next to each other. It was built during that separate but equal time period. And the mandate and the project was to link these 2 schools together in a major renovation. But the key thing was the superintendent was, I honestly don't know where this gentleman came from. He was a visionary. And what he basically said to VMD Architects was like, hey, there's 3 schools in our entire school district. And the $50 million that we're about to put into this school, it's not just the only $50 million that are going to go into schools in the next 20 to 30 years. It's the only $50 million that's going to go into children's health for the next 50 years. So that's great. You're about to make me a green building. I consider that table stakes. What I need this school building to do, this moment of our community, I need to address the biggest issue in our community, which is actually childhood obesity. So that was the challenge. And as I was joking with some of the colleagues here today, I have been running around doing talks about how important it should be for doctors and designers to work together. But they called my bluff and basically were like, well, let's do it. And so that's what we set out to do. And essentially what we did together was I brought all the decades of school-based obesity prevention programming I could find. And then through this collaboration that really changed the course of my career, I worked with architects, these architects to kind of create actual spatially relevant design guidelines for both physical activity and actually healthy eating. And we published all of these. And then VMDO used these guidelines to actually design the school. And then we provided also some help evaluating it. And what was really amazing was once we had set the story within the community of the school as being about childhood health, it totally changed the support we had for the things we were proposing. And I think this is really important as we get to discussions of healthcare. The community really latched on to the idea that the fundamental health story was a health one. And it really helped as we got to those inevitable moments of value engineering and so forth along the way. So what do I mean by that? This is how the school ended up. I mean, we ended up with these beautiful architectural stairs that were evidence-based for things like promoting active, physical activity, not just on a daily basis in terms of real behavior, but also as just kind of mindset and attitudes that I believe actually as a pediatrician, and perhaps the biggest impact we can have is setting long-term kind of attitudes among these children about a kind of how to be active in their daily lives. Again, that kind of support from the school board and so forth to do this project meant that when it came time to do like furniture choices, there was support for choosing some really interesting kind of active-based furniture, which is shown to reduce sedentary time among children. It even came down to having support to develop kind of standardized iconography and signage. So I had noticed that when you go to really high-performance green schools, there's always a binder in the front where the kid will take you on this cool tour, showing you all the sustainable functions of the school. And so we reverse engineered it around, well, what would happen if the kids could do a health tour of their school, and how do we make it celebrated and kind of highlight what the active ingredients are of the school? So it was, everywhere you went, we had consistent iconography and messaging that was all kind of evidence-based about what was happening with these stairs or water fountains or whatever we were doing. And essentially, I'm really proud of this school. It truly has a sense of a kind of a culture of movement that you can kind of feel. I mean, this is even some small things, like we had this idea of visual adjacencies, like as much as possible, anywhere you are in the school, we tried to have interior windows that you could see other children being active or see things like the school garden and so forth. So it was a lot of fun to think through this, and I think it was really effective. So those are some of the examples. So we have this issue. The data say we need to do this. We can do this, at least on a one-by-one basis. But then it's finding out, okay, well, how do we all each participate? And this is something I've been trying to focus on, because I think everyone in this room, I firmly believe already is like, I'm in. How do we do this? But how to operationalize these things can be challenging. So, and also the key thing is, as cool as these individual projects are, the reality is to have a big impact at the public health level that I'm talking about, we're going to have to go beyond, as my longtime research colleague, Chris Pike says, random acts of health promotion in the built environment. Chris has actually worked at the U.S. Green Building Council for many years, and he always pointed out that that was actually the big contribution of LEED and so forth. It kind of took random acts of sustainability and codified it. And so that's become my way of trying to make a difference on this, is to learn from that, that green building success story. So where I've gone from that one-off experience was, how do I scale this up? And thinking about how do you make a market perhaps for this health promotion design that we're to start describing. And if you're interested, you can see this is something I've been pursuing now for the last 5 or 7 years as an academic, thinking about green building as a model for making health promotion now standard in the built environment. And that's why it really is very exciting and a dream come true. Actually, first of all, that something like the WELL standard even exists. Like, I was kind of describing this, as you've heard my story, abstractly for many years, but now that the International Well Building Institute exists, and I was privileged to become the chief medical officer a few months ago, I'm doing this now as my day job, which is pretty cool. And our main product, is just to give you a basic, for those of you who are not as familiar with it, is the Well Building Standard. And it is the tool, the leading tool for advancing health and well-being in buildings and communities globally. And again, it's based on, it's very fundamental. It's based on those same ideas and the same research that I was citing, of this idea that the buildings where we live, work, learn, and relax can really profoundly impact our health, well-being, and productivity. And I think something that's really, it's exciting, it's daunting, but it's necessary, is how holistic the approach that WELL is trying to take on this. It's built across 10 concepts, which you can see here, which are all evidence-based. But again, what's really cool to me is that it's providing a framework for trying to operationalize all that stuff that we were kind of bootstrapping when we were doing things like the school design project that I explained to you. And what's exciting about it, and it's again what we're getting the opportunity to do, and what I'm getting it to do in my new role, is to now try to go into organizations and help them think through some pretty big concepts and think about how their facilities and the policies related to those facilities can take on some of the biggest issues that we're facing these days. And just to give you a sense, if you haven't engaged with IWBI in a while, what's really remarkable is this is now becoming a truly global movement, doing the Well Building Standard. We are now in close to 100 countries, and as you can see, we have the things that I really are excited about is we're getting close to 20,000 Well APs across the world who are specially trained in this thing. And it creates an opportunity to really codify a language, again, around these things that I've been doing kind of as one-off. And I'm also hoping that it can be maybe useful to you in the work that you guys are doing. So, which brings us kind of to the final piece. Like, how do healthcare systems potentially fit into this? And I think, as you've heard over and over again, I'm just the latest one to say it, I think we're at that moment. I love that idea. I agree with everyone that we're at a kind of profound moment of change where we do have to think differently about how health systems position themselves within the community and what they think about as their role. And I think being here really has been exciting because it's just real wonderful to know that there are people out there in the healthcare design world thinking this way and challenging us with these excellent questions like I got to engage with yesterday about how do we create flexible, adaptable spaces and the processes that we need to make those happen. And I think basically my take on it is it's not the only solution, but one thing I think we really have to do is think about how do we change how we design and who do we engage. And particularly, like, this is, UVA just went through a $500 million project, doing a new emergency department in Bed Tower. And the crazy thing was watching how my chairman, who is a world-renowned expert in emergency medicine and an amazing researcher, but not an architect, was somehow supposed to kind of how to leverage his expertise in setting this thing that's going to determine how UVA delivers care for the next 30 years was quite remarkable. And then also, as we've heard, figuring out how to capture patients' perspectives better in design, I think, is something we all need to do together differently. I'm trying this on a really micro level, so I'm doing it on the macro level, working with WELL. I'm also trying to teach med students through what I call the med design program to kind of help them as young physicians, I basically took them on tours of the emergency department just to have them understand how space comes to be, so that maybe they could be more active participants at some point during their career when it's their turn to kind of lead one of these projects. And I think the complexity of what you guys do really blew them away. I think even realizing how early in a project they would probably need to be there in order to have like the big picture conversations, and how easy it is to lose the forest for the trees in the middle of such an incredibly complex undertaking. But it did turn out well, and I know that I think, so the answer is that this can work together, but I'm hoping that maybe what we can do together is use these tools like all the other tools that are out there, all these amazing frameworks we've been talking about in the last few days. And I think if we can learn how to engage clinical expertise, learn to engage patients, I think I just wanted to leave you with this sense that like what you're doing is really important, not just to the individual patients, but this is one of the biggest parts of public health right now. And so what you're doing just really matters. And I'm really excited to join in with you as a partner going forward. So thank you very much. Appreciate it.